Let's discuss lower right back pain and start from children. The most common cause of lower right back pain in children is muscle strain or ligament strain. It happens due to awkward playing, awkward position, or physical activity, and pain nature usually localized. And discomfort occurs during movement or stretching this muscle, and pain will relieve by rest. Second common and important cause of lower right back pain is appendicitis. Lower right back pain for appendicitis is not common and classical symptom, but it can happen in case of children. And how we can detect? Pain usually starts around navel and it becomes stronger and stronger and gradually shift to right part of abdomen, and it can radiate also on the back. That's why it's important. It's usually emergency condition, and that's why we should not miss appendicitis, and we should pay attention appendicitis symptoms. So it starts around navel on the abdominal pain and gradually shift to right, and it can also radiate to right back. So we can detect appendicitis, and pain occurs during coughing also, and that occurs around 5% of cases. And scoliosis is also important cause of lower right back pain in children. And how we can detect scoliosis? We can detect because person has visible curvature here on the spine, which can have S shape or C shape. Both are possible. And one shoulder is more prominent than another shoulder. It's also a sign. And such children difficulty standing upright position, and or sitting difficulty for long period of time, and they need to lean. Such symptoms of scoliosis. So we have three most common cause of lower right back pain in children. It's muscle and ligament strain, appendicitis, and scoliosis. Now let's say about adult women. In case of adult women, most common cause of lower right back pain is still muscle and ligament strain in around 30% of cases. And second most common cause is kidney stones and kidney infection. Now let's say how we can differentiate that if it's kidney infection or just muscle strain. Kidney infection and kidney problem is sharp pain radiating to groin, and we have urinary symptoms. It's important. So sharp pain and is not relieved by rest. During rest we also have pain. Possible frequent urination or pain or burning sensation during urination. That's urinary symptoms. So we can sharp radiating pain to groin plus urinary symptoms. That's kidney stone or kidney infections. And fever and nausea. Fever is more common in case of infection, and nausea and vomiting more common in case of stones, kidney stones. And what is hallmark of this condition? As we said, urinary symptoms plus sharp pain. Next important cause is herniated or bulging disc, spinal disc, of course. It affects around 25% of cases. And what is symptoms? Symptoms is pain, back pain, which is radiating down the leg. So back pain which radiates to leg. That's herniated disc or bulging disc. Numbness, and this numbness is also common, and pain worse with movement and relieved by rest. Mechanism of action, you can see here is spinal disc, and with this spinal disc can bulge from its place and compress nerve, and this nerve compression causes symptom. That's the idea of herniated disc. And another common cause which can cause back pain in women is osteoarthritis. Osteoarthritis is usually associated with age, and symptoms are dull stiffness, limited range of movement, and crepitus. So these symptoms usually dull pain, stiffness, morning stiffness. When person awakes, it feels stiff in the morning, and this stiffness will disappear after 25 minutes, usually less than 25 minutes. It's osteoarthritis, and it's associated with age. And what's mechanism of action is degeneration of joints, and not only spinal joints. Usually people have degeneration of joints of hands, knees, hips, and that's why usually it's not isolated back pain, and person knows that she has osteoarthritis because she has problem on her joint, not only spine but also on her knees, hips, and hands also. And hallmark of the disease is gradual onset, stiffness, limited range of motion, and morning stiffness, as we said. Now let's say about men. In case of men also, most common cause is muscle strain. Second most common cause is kidney stones, and also herniated disc is common. Also, this herniated disc is also called sciatica, and we can differentiate them. How? In case of kidney stones, pain is sharp, not relieved by rest, and pain radiates towards groin. And in case of herniated disc, pain radiates towards leg. That's most important differences. And third common cause in case of men is degenerative disc disease. It actually looks like osteoarthritis, and we have degeneration, gradual onset, and more localized pain and association with age. That is case of men. Now let's summarize. If we have lower right back pain and there is kid, most common cause is muscle and ligament strain, and it's actually nothing, it will go away, just need appropriate rest. Appendicitis is important. Pain starts from navel, around navel, and radiates towards right. It's appendicitis. Scoliosis. In case of scoliosis, we have S or C shape curvature of spine. In case of women, we should pay attention kidney infection and kidney stones. We should pay attention of herniated disc or bulging disc, and pain radiates towards leg. And in case of men, also we pay attention kidney problems, herniated disc also, and degenerative disc disease. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.